afternoon, Richard. My name is Erica. The date today is the 17th of April 2019 and the time is 1300 hours. I'm recording a video for my carver to cover airway management. There will be no gaps in the video and will not be edited before submission to my assessor. There will be 4 people present for my session. That will start now. So first of all, Richard, we discussed an assessment plan before today. Are you in agreement with this assessment plan and are you happy with all the learning outcomes that we identified?
Yes.
Okay, thank you, Richard. So we're going to start now with this scenario, and I'd like you first to start from all your scene safety procedures.
Okay, so on approach to the scene, I'm looking for any danger to the patient, to myself or any of my colleagues.
Okay, it's safe to approach.
Okay, so on approach to the patient, I'm noting their position, I'm noting their colour, and I'm also noting any clues to the MOI.
There is no signs of injury, but the patient is very pale in colour.
Okay, so we're going to now look at getting a response from the patient. We're going to try first of all with a verbal response. Do we know the patient's name?
The patient's name is Billy.
Hello Billy, this is Richard from the ambulance. Can you hear me?
And there is no verbal response.
So we're going to look at getting a pain response, and we'll either do that by looking at the top of the eye socket or a little pinch on the trapezius muscle. In this case we'll go for the eye socket.
The patient is slightly moaning.
Okay. We're now going to look down the length of the patient and see if there's any catastrophic hemorrhage.
There is no catastrophic hemorrhage.
And then we're going to get on the radio and we're going to call control and look to get some paramedic backup.
Okay, Richard, so control has been notified and a paramedic will be with you within 15 minutes.
Okay. We're now going to move on to the patient's airway. So we're going to have a look in using the click method with my finger and thumb. We're going to have a look in and see if there are any blockages in the airway.
There is no obstruction.
Okay, now considering the C-spine, we would now perform a head tilt to open up the airway.
If your airway wasn't clear, Richard, what would you do?
We could use suction and we could also use postural drainage to clear the airway.
Okay, thank you. So how are you going to measure up for the airway now?
Initially we'll put an OPA in. With the OPA we'll look at measuring from the corner of the mouth to the corner of the jaw. If we're happy that that fits, we'll just open the patient's airway, we'll invert it, insert it, rotate it and place it, and then we'll look at putting 2 MPAs in as well. So with the MPAs, we'll just lubricate the end of them, just to help them go in. To measure the MPA, we'll go from the tip of the nose to the tragus on the ear, and that's fine. So when we're inserting them, we'll go for the right nostril first, because that's the larger, and we'll look at just popping it in about 10mm with the curvature of the MPA, and then we'll come up to about 90 degrees with a to and fro motion, and insert that MPA in. And we'll consider putting a safety pin in the end if we had any, just to retain it in the nose. We'll do the same, lightly lubricate the end of the second MPA, and exactly the same using the curvature of the MPA as a guide, come up to 90 degrees with a to and fro motion. We'll pop that in, and that's the airway secure. After the airway, we'd move on to breathing and circulation, as long as we were happy that that was a secure airway.
Thank you very much, Richard. How would you demonstrate how you would advance this even further?
If we were to step up the airway, what we would do is remove the OPA. Before we do that, we'd prepare an eye gel. Take it out of the wrapper, and we'd select the eye gel. It has a weight category on it, which we'd select for the patient, which would be suitable for them. Pop a little bit of lubrication on the plastic handle and lubricate the edges of the eye gel. Once that's prepared, we'll remove and discard the OPA. Again, using the curvature of the eye gel as a guide, we just insert that straight in and secure it in place.
Okay, I'll stop you there, Richard, and thank you very much for your time today. feedback will be with you by 3 o'clock this afternoon. So thank you very much for your time.